Good day, dear viewers and listeners of Equinoxe Radio Multimedia. It's a pleasure being with you on today's edition of the program You're in Health on Equinoxe Radio Multimedia. Today, the world faces a silent threat known as high blood pressure, also known as hypertension. This is a leading cause of serious complications like we have diabetes, we have stroke, and to some extent, we have death. That's how fatal this disease can be for some victims, not just in Cameroon, but equally across the world. And to answer questions on this particular pathology, we'll be receiving a cardiologist, and he's one of the best, not just in the city of Douala, but of course across Cameroon. Good day, doctor. It's a pleasure to have you on the program.
Happy New Year, Immaculate.
Happy New Year, doctor. And you know he's Dr. Cabral TANTCHOU. He is a cardiologist at the Padre Pio Hospital right here in the city of Douala. It's always a pleasure to have you on the program.
Thank you, Immaculate.
Doctor, we are talking about something that has been described by many as a silent disease that doesn't just affect anything, but there's no specific age group. Anyone is prone to it. But then we want to know how we can manage to escape from the deadly consequences of this disease. We are talking about high blood pressure. Can you tell us, first of all, what's high blood? Who can we consider as being hypertensive, and how can it be diagnosed?
Thank you very much for this topic. And again, it's a topic that is always actual because as you said, the majority of people, sometimes they are hypertensive and they will not know. There are some that are dying because of complications of hypertension, as you mentioned. There are so many people, because it's silent, as you said, it's really silent. And I received again today a patient that came, and he told me that he was in his friend's house because the friend was coming from abroad. He came to visit him, and the friend came with these BP machines, electronic machines. And he took his own blood pressure, and he just asked the person to take his own too, because, he doesn't lose anything in taking his blood pressure. The first one took his blood pressure, it was normal. And the second one took his blood pressure, it was very, very high. It was something like 190 on 110. You see, and he just said, I didn't feel anything. And I'm fine. But this the group that can, let's say, die all the time. It can have stroke, it can
cardiac arrest.
It can have myocardial infarction, it can have, so many complications of hypertension. But it's silent and it doesn't know, and that's why this topic is actual. And if you can talk about this and talk, and those who are hypertensive, they should know their condition and they should take their medication. The blood pressure should be controlled, etc. There are so many articulations. There are so many things that we should talk about hypertension. What is hypertension? Actually, blood flows in the vessels with a particular tension or with a particular pressure on the vessels. When it's high, when it's above a particular level, we're talking about hypertension.
Okay.
When it's above 130 on 80.
130 on 80.
Yes.
Okay.
We talk already about hypertension. And sometimes people, they are not having any symptom, like that gentleman. No symptoms. And the majority, they discover that they have hypertension when they're having complications like stroke. Someone is landing in the hospital with stroke, and if the person can talk, because there are some cases when the person is aphasic, the person is in coma, all the stuff. When the patient can talk, you ask if he's having hypertension, will tell you that no. He doesn't know, he didn't know that he was hypertensive, and now it's the first time when he's having already complications. And some other people, this when there is sometimes the eye doctor that is telling the ophthalmologist that is telling him to come, or telling them to come and see the cardiologist, because there are changes already in the eyes that shows that the person has been hypertensive for long. Of course, there are a particular group of people that are having symptoms, headache, the frontal side, or sometimes the neck. Sometimes, many people, they are having sometimes neck pains and saying that I'm having nerves. Yes. Some people sometimes, when they're ascending, a particular distance that they are not having any problem, they start having problems breathing with difficulties. Some can be chest pain, some can be palpitation, some can be, there are some that are having complaints, but still, since they're not feeling pains, they stay at home, and sometimes, or they will taking garlic or taking some kind of concoctions and thinking that it will help. My people, those concoctions, they don't help at all. They don't help. They don't help. Garlic will not help. Come to the hospital and take medication that will help you. When you are having those symptoms, as I've said, yes, come to the hospital, let them check your blood pressure and see how it is. When you are hearing somewhere, screening for hypertension, for diabetes, for this, for that, go. Just go and get screened. And if yesterday we're not hypertensive, it's not meaning that tomorrow will not be hypertensive. It just comes like that. And again, now we'll be talking about, the risk factors of cardiovascular diseases. What are the risk factors? The risk factors are some conditions, some diseases that can prompt someone to have complications of cardiovascular diseases or complications of or death or cardiovascular death. Yes, and they are modifiable cardiovascular risk factors, and they are not non-modifiable. There are some that are not modifiable, like age. You cannot change your age. When you are above 50 in males, in males, you can develop hypertension. Okay. And again, the race, black people, when you are above that age, come and check your blood pressure, and it can be high because the third of people, if you are taking, let us say 100 people, something like 30 people will be having hypertension.
Okay.
Yes.
For those who would like to participate on today's edition of the program, here are the contact: 670-5470-49. I repeat, 670-5470-49 or 656-6222. 656-6222. Our lines are open for you to call and ask questions as far as hypertension or blood pressure is concerned. Back to you, doctor. We'd like to know, how different is high blood pressure and low blood pressure?
Yes, high blood pressure is when the blood pressure is high. Yes, low blood pressure is when the blood pressure is low. And the high blood pressure really is a disease that we know, many people already know, and you should take medication. Meanwhile, low blood pressure, sometimes you should not take any medication. It depends. We should investigate and see what is bringing low blood pressure. Low blood pressure can be in a condition that we call shock. It can be septic shock, it can be traumatic shock, it can be, somebody that lost, it was dehydrated. Yes, it can have low blood pressure. And there are some that are born, they are having low blood pressure and they are okay. It's when you are symptomatic, you're having low blood pressure and you are tired, a small thing, you cannot do anything, fatigue. In that case, yes, something should be done. And not only that, we should still investigate and see what is bringing that blood pressure low. If there is nothing, in that case, we'll just manage like that. There will be, there can be some recommendation to be drinking much water, to feed yourself properly, etc. Meanwhile, blood pressure, you need some particular type of medication. We're talking about modifiable, non-modifiable risk factors. And we mentioned age, we mentioned the race, we mentioned the sex. In male, 50, and in female is when menopause is close, that they can develop hypertension. Although they are in Africa precisely, and here, there are so many young people, 30 years old, that are having hypertension. Not secondary hypertension, essential hypertension, because secondary hypertension is when there is a particular disease that is changing the hormonal system of the patient and making the blood pressure to go up. Meanwhile, essential hypertension just comes like that. And non-motivational factors also is hereditary. If your parents are having hypertension, you can develop hypertension too. And the factors that can be modifiable, like obesity, people that are fat. It's obesity, yes. Sedentarity, people that don't do physical exercises. Drinking of alcohol, smoking, yes.
Is it possible in this country to avoid that? You know what I'm talking about.
Immaculate, we should reach there.
Okay.
We should reach there. Why? When health is concerned, if you want to destroy yourself, destroy yourself. That's what usually I say to my patients, because the majority, what about alcohol? These young fellows. What about alcohol? I said, no, you should stop alcohol. What? Yes, you should stop alcohol.
Like completely stop, doctor. Is there no way of, let's say, moderating the amount of alcohol we take?
WHO and the World Health Federation said no drop of alcohol is needed for our organism.
Okay.
No drop of alcohol that is needed in our system. Let us say exogenous alcohol, the one that is coming from outside, like the one that we drink. No, we don't need it because the liver produces what we need for our body. You don't need something from outside. Yes.
Okay.
Yes, according to the new recommendations that we see in the literature. Of course, yes, there are some, when we read also, is that sometimes we are lost.
Okay.
Sometimes we are lost because this one, you say take this, the other one, you say take that, the other one. Yes, you say moderately, yes. Sometimes they will say you should reduce the intake of alcohol. You should take but white wine. You should take but this. You should take but that. But the best is to drink water.
Okay.
The best is to drink water. You will not die. You will feel yourself better. Yes, you'll be healthy, people. Yes. And you're asking if we can reach. We can reach, definitely. We can reach if we are determined to do that. And again, people that are reducing or people that are stopping alcohol completely, they're fine. They are good. They are good. The problem is that in our country precisely, it's like, those off licenses, it's so easy to have everything. It's so easy to drink one crate if you want to.
That's one of the main
and sometimes,
problems.
when you are going for distraction, if you are taking only a bottle, the lady that is selling say only.
No, fill the table. My bill. For you think the person is doing good for you, whereas we know the consequences at the end.
Definitely.
Okay. Now, you talked about monitoring our blood pressure frequently. What do you mean by frequently? How often?
Very, very important. It depends on the person, it depends on the patient that we're having in front of us, and it depends on the conditions. It depends, there are so many factors.
We have a call on the line. We'll be coming back to that question. Hello, good afternoon.
Afternoon.
Your name, where you're calling from, and your question.
My name is Mr. Biga. I'm calling from Balijan.
Thank you so much. Go ahead.
Yeah, I want to talk to the doctor.
Yes, talk. Can you turn off your receiver, please?
I want to ask. He said if somebody is 130 above 180, the person is already hypertensive. So I have two questions. Second one is when the ear is whistling of the ear is what is which problem? That's my two questions. Thank you.
Did you get a question?
Yes, the first question is concerning the readings of the blood pressure, 130 over
180,
80, yes.
Exactly.
And second question is whistling of the ears. Yes, usually each year or each 2 years, there are recommendations that you should follow. The World Heart Federation is having recommendations, sometimes WHO, the European Heart Society, sometimes when you go to congresses, the thresholds, they used to change, that's why you should read all the time.
Okay.
It's according to the new thresholds of the blood pressure that they are saying when your blood pressure is more than 130 on 80, you are hypertensive. In the past, it was not like that.
Okay.
Yes.
How was it like in the past?
In the past, it was, when you are having 140.
Okay, so it has instead dropped.
That's it.
Okay.
It has dropped. Or probably according to the new studies that were done there, they came to that conclusion. That's why sometimes you say that we see in Africa we need something probably to do our own and find out what can be applicable or what we can use in our setting. But sometimes when you see the threshold, you ask yourself so many questions. Anyway, when your ears are whistling, gentlemen, it can be that your blood pressure is high, actually. And it can be that you're having a problem with your ears.
We have another call on the line. We'll be coming back to that. Hello.
Hello, good afternoon, madam.
Good afternoon, sir. Your name, where you're calling from, and your question, please.
I'm called Mr. Edwards. I'm calling from Africa.
Calling from Bafusam. Okay, go ahead.
Is this diabetes, is this high blood related to diabetes, H1 cancer? And very often in the hospital we are told that diabetes cannot be cured. Is that true? What should we do? Thank you.
Did you get a question?
The second question I didn't get well.
Me too. I didn't really get it so well, but he was talking about diabetes not being able to be cured. But we should go back first of all to the one of the ear.
Yes.
Then we'll go now to the next caller.
Yes, whistling of the ears usually can be due to very high readings of the blood pressure. And when you take your treatment, and when the blood pressure stabilizes, it disappears. And it can be also a problem with your ears, and you should see the otorhinolaryngologist.
Okay, we have another call on the line. I think we'll just take this caller. Hello.
Yes, hello.
Good afternoon, sir.
Yeah, good afternoon.
Your name, where you're calling from, and your question.
Yeah, this Damon Lawrence calling from Japan.
Okay, go ahead.
Yes, I just want to ask the doctor, I want to know the immediate cause for low blood pressure.
Immediate cause of low blood pressure.
Yeah, thank you.
Okay, thank you. We'll go now back to the second caller who was talking about
diabetes.
The connection between hypertension and diabetes. I think you earlier talked about it.
Yeah. Diabetes is a cardiovascular risk factor.
Okay.
Yes, and diabetes, sometimes when it goes with hypertension, it's a very bad combination. All the medical personnel knows about that.
Okay.
And you need treatment, you need some kind of lifestyle modifications, and if really you abide to all those regulations, you'll be fine. And diabetes type 2 can be treated. It can be treated if you follow instructions, if you follow diet, if you lose weight, if you are taking a medication. At the time, in some people, really, it disappears.
We have another call on the line. Hello? Hello?
Hello.
Yes, sir. Please, can you turn off your receiver and go ahead with where you're calling from and your name and your question?
Yeah. Okay.
Go ahead, please.
My name is Christopher. I'm calling from Boden.
Okay. Your question?
Yes, please. I want to ask the doctor what causes the blood pressure.
Didn't get you, please.
As I want to ask the doctor what causes phobia and blood pressure.
What causes high blood pressure?
Phobia. When you have phobia, what is the cause of it?
Okay, phobia for high blood pressure.
Yes. Which means if you see the high blood, the machine.
Yeah.
Pressure is automatically
Okay. Okay, we'll be answering that question. Thank you so much for participating. We'll first of all go to the one who asked, the third caller who asked for the immediate cause of low blood pressure. Yes.
It's complicated to tell you the immediate cause of low blood pressure. I mentioned some kinds of condition in which we can have low blood pressure, like dehydration, like trauma,
Stress.
like sepsis, like stress.
Okay.
Yes, these are probably the main causes of low blood pressure. But there are some people that are born and they are growing up with low blood pressure. That's why I'm saying that you should come and investigate and see what belongs to who and know what to do next.
Some people are so scared of the machine.
Yeah.
Okay.
Why coat blood pressure? Yes, we know there is a particular diagnosis called white coat blood pressure, high blood pressure. Yes, because we know that so many people, not only the machine, when they enter the hospital, the gate of the hospital, it looks like, the heart start pounding and they are anxious, etc., probably due to the trauma that they had, the previous traumas, etc., or they're having hypertension, they're afraid that blood pressure will go up again, etc. In that case, they say a particular approach: buy your blood pressure machine at home.
No, he didn't say what at home or whatever. He said when he sees the machine, he's scared.
No, in that case, no, he should change his mind about the machine. He should change his mind about the disease itself. Probably should read more concerning hypertension. Or if it's so complicated, he should see a psychologist, I don't know, if psychiatrist, someone that deals with mental health to help. Yes, because usually the main problem is that when people that are having hypertension, when they come, they are afraid that the blood pressure will still be high.
Yeah.
And they are tensed. And when they are tensed, it's making things worse.
That's true.
You should just relax. And you should get more information about hypertension. And again, buy your blood pressure machine and take at home. Yes, and this is really documented. It's scientifically proven that Really, some people, when they come, the blood pressure is high, and if it is like this, you do like this, let the patient rest, let the patient relaxes, etc., etc., etc.
Can hypertension be reversed or effectively managed?
Definitely. Definitely. It can be effectively managed. You can reach the goals in patients, in all patients actually, if the patient is compliant, if he goes to the good specialist, if all the tests that are requested to diagnose the case are done, definitely.
So there's some okay.
Yes, of course, lifestyle modifications. We mentioned alcohol, we mentioned tobacco, we mentioned sedentarity, we mentioned obesity, we mentioned all those physical exercises. Yes, you should abide to everything. There are so many people that are coming, the blood pressure is good, actually, and we are happy, the patient is happy, everyone is happy, but there's a group, a careless group, people that are, I don't know how I can call them, irresponsible. Yes, because when you say you are irresponsible, the person will be angry, and the person will say, the response there will not be good. But that is what is there. And again, people that are taking concoctions, if you are taking concoctions, traditional herbs, etc., for the blood pressure to go down, my friends, stop it. Okay. Stop it. Come and take medication. And again, internet is having that, I'm saying, rubbish. Rubbish. You see a particular cardiologist, they will advertise a particular cardiologist in Cameroon that is selling a particular portion.
Someone who has not even been trained just wakes up and say, I am a cardiologist.
That's it. A cardiologist, you come, meeting of cardiologists is not there. He's in town.
Okay.
And etc. He's having a particular portion that is selling on internet, and people will go and buy it, and it treats hypertension for 2 weeks.
It treats even all types of hypertension. Okay, thank you so much, Dr. Cabral TANTCHOU. It's a pleasure having you on the program today.
Thank you, Makule.
And we equally want to thank all our technicians. We had Louis Pego, we had Jonathan Biabola. I equally want to thank you, our listeners and viewers, for always staying with us. Take the rendezvous for next Thursday, same time. God willing, bye-bye for now.